Good evening, everyone. So, my next topic of the video, which I'm going to discuss with you, is on intravenous strip, which is appropriate setting up of intravenous strip in a simulated environment. In this video, I will discuss with you how to apply intravenous strip and other things related with intravenous strip. And before I start my video, I want to request you if you like this video and if it is helpful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika Pharmacology Discussion. And now I'm going to discuss with you intravenous drip. Now, conditions requiring intravenous drip of infusion or infusion. What are the conditions which require intravenous drip or infusion? Infusion of large amounts of fluids and electrolytes, absence of dehydration and shock. Now, in person suffering from dehydration or a person suffering from shock, we have to give large amount of fluids and electrolytes. For that, we have to set up the intravenous drip. Intravenous infusion of the drugs. Now, we have to infuse some drugs like dopamine, which is the cardiac stimulant drug, dobutamine cardiac stimulant drug. For anemia, we have to give iron. For hypoglycemia, we have to give insulin. So, in patients suffering from diabetes mellitus on insulin therapy, we can give uh, uh, insulin and in various medical conditions. To avoid multiple needle prick injuries, needle pricks, multiple needle pricks, to avoid those multiple needle pricks for giving IV injections in frequent intervals in certain conditions in hospitalized patients, the slow IV infusion drip is maintained. Means we have to avoid multiple needle pricks. So, to give the drugs at intravenously at certain frequent intervals, we can use the IV infusion or drip. Blood or blood products in case of thalassemia, in case of iron deficiency anemia, or in case of megaloblastic anemia, blood and blood products, etc., can be infused through IV infusion or drip. Now, what are the advantages of IV infusion? This is for maintenance of IV line during emergency. When we have to maintain the IV line during emergency, like in persons suffering from dehydration or shock, during emergency, we can give the IV infusion. Dose regulation is possible. We can regulate the dose. IV infusion, there is drip chamber. In the drip chamber, we can regulate by the regulator. We can regulate the dose. 100% drug is available for systemic effects. Means as the drug is poured inside the systemic circulation into the blood, so 100% of the drug is available for the systemic effects and has the rapid onset of action. Directly, it is delivered in the ducts in the blood. So it is directly absorbed from the blood from the circulation and it has the systemic effects and rapid action. Large amount of fluid can be given over a long time. For a longer period of time, we can give large amount of fluid. IV line once established can be used for multiple IV injections to multi-way cannula of IV drip. Now there is multi-way cannula by which we can give them multiple injections to the IV cannula is there, intravenous catheter. We can give multiple injections by setting up of IV set or IV drip set. And drugs which are to be given IV in diluted form can be given as IV infusion. Means we can, in the drip bottle, in the infusion bottle, we can insert the drugs and the solution will be made. And then we can give as the IV infusion in diluted form, the drugs can be given. Disadvantages of IV infusion is we have to require a trained paramedical staff is to be required. Is technically the patient, the person who is giving the IV set, IV drip, who is setting up the IV drip, he should be very much trained paramedical. Any air bubble on IV set may enter circulation causing air embolism. Now, when we have to set the IV drip set, we have to remove the air by regulating the drip chamber and in the tube, in the IV tube, we maintain the flow of the fluid so that air gets eliminated from the IV fluid, from the IV tube. If the air will not be, air is present in the IV tube, that can lead to air embolism. Thrombophlebitis, that is the infection of the vein can occur, for infusion may occur. which is used, the vein which is used for the infusion, there can be thrombophlebitis of the vein can occur. To avoid direct introduction of the infection in the body, strict aseptic conditions are required. Now, we have to maintain the strict aseptic conditions. We have to use the spirit swab before setting up of the IV cannula because the infection has to be avoided. Drugs and procedures are costly. Drugs which are given by IV set and all the procedure, that is the IV infusion bottle, IV set, IV cannula, these all are costly. Initiation of IV line is painful and slightly difficult because we have to insert the needle IV cannula in the vein at the angle of 30 to 40 degree. So initiation of IV line, it will be painful and it will be difficult. Extravasation of some drugs may lead to local swelling, pain, and necrosis. Is whenever there is a extravasation of the drug occurs outside from the vein, it can lead to in the surrounding tissues. It can lead to local swelling, pain, and necrosis. IV fluid should be sterile, clear, and transparent. Means IV infusion bottle, which is filled with IV fluid, it should be clear, transparent, and sterile, and no foreign particles should be there. Now, types of IV fluids depending upon osmolarity, they can be divided into hypotonic, isotonic, hypotonic, and hypertonic. Isotonic, they have a osmolarity 310 milliosmoles per liter. That is normal saline or Inger's lactate, normal saline 0.9%. It is used for hyponatremia because normal saline has sodium in it, sodium ion in it. So it will be used for hyponatremia and it is avoided in the heart failure, pulmonary edema, and renal impairment patients. Ringer's lactate contains sodium chloride, potassium, and calcium, and it replaces the GAT fluid and corrects dehydration and hyponatremia. Again, Ringer's lactate can be used to treat hyponatremia, to correct the dehydration, and it can replace the GAT fluid. Hypotonic is when osmolarity is less than 250 milliosmoles per liter. It is 0.45% sodium chloride solution, which is used in the hypernatremia. Whenever there is hypernatremia, we can give this 0.45% sodium chloride solution, hypotonic fluid. Hypertonic fluid is osmolarity is more than 375 milliosmoles per liter. 3%, 5%, 20% sodium chloride, 5% dextrose in normal saline, 5% dextrose in Ringer's lactate. These are given. Dextrose is the glucose derivatives, which is really given in the hypoglycemia in patients suffering from diabetes mellitus and they are on insulin therapy and they suffer from hypoglycemia. So we can give 5% dextrose in normal saline and 5% dextrose in Ringer's lactate. Hypertonic, 20 to 50% dextrose may be used. For severe sodium loss, now hypertonic fluids can be given in hyponatremia for severe sodium loss. Now, types of IV fluids depending upon the users in different conditions. And that can be maintenance fluids, which maintains dehydration in shock. We can maintain the fluids in hypoglycemia. We can maintain the fluids. And in hyponatremia and hypernatremia, dextrose can be given and normal saline can be given. Replacement, like in dehydration shock, in hypoglycemia, we can give normal saline and 5% dextrose in normal saline and Ringer's lactate. Special fluids like sodium bicarbonate, potassium chloride, and 25% dextrose. Now, how we have to prepare the IV drip? For the preparation of IV drip, we need to require the IV set, IV drip stand to set up the IV set, IV infusion bottle, and IV set has to be required. IV cannula 20 gauge, IV fluid bottle, spirit swab, adhesive tape to adhere the cannula to the skin, tonic wedge, air inlet needle, drug ampule or drug vial with diluents. Means we require the drug ampule or drug vial with diluents, and sterile disposable syringe can be used. Now, what is the procedure? First of all, we have to set up the IV drip stand and we have to hang on the IV infusion bottle to the IV drip stand. And we have to see that there is no impurity present in or suspended particle present in the IV infusion bottle. Then we have to we have to assure the patient and we have to explain the risks. And then we have to set up the IV cannula. How? Like we can apply the tourniquet here if we have to insert the cannula over the dorsum of the hand. We can apply the tourniquet at the wrist or in the upper arm if we have to apply in the lower arm. So we have to apply the tourniquet at any immobilizable site. Means we have to take the left hand or left arm, non-dominating hand, and we have to apply the tourniquet and the vein will be prominent. We have to clean the injection site by the spirit swab from center to periphery. From center to periphery, we have to clean it and wait till it dries. Now we have to fix the vein with index and the thumb of the left hand. Then we have to insert the cannula. We will insert the cannula with needle into the selected vein, and we have to, once the blood appears in the cannula, leaving cannula in its position in the vein, when blood appears in the cannula showing that this is in the correct position in the vein, we have to take out the needle. And when we then we have to fix the underlying skin with adhesive tape. We have to adhesive tape से हम cannula को fix कर देंगे towards displacement of the cannula from the vein. Now IV infusion set, we have to take the IV infusion set now. The blood which is appearing in the cannula, we have to fix it. We have to cover the cap with cap, the back of the cannula. And now we have to, there is IV infusion set. It has the piercing spike that will pierce the infusion water, and which is followed by the tubing, which is followed by roller clamp. The drip chamber. Drip chamber is having filter to filter out any suspended particles, and then drip chamber is attached to roller clamp or regulator, which will regulate the flow of fluid. And we have to maintain the fluid in such a way that that air has to be ejected from the tube. Then tube is present, and then connector is present in the end. By the connector or by the lure adapter, we will uh, connect the IV set with the IV cannula. Regulate the fluid, and we have to first of all we have to regulate the fluid such that air gets expelled out, and we have to regulate the fluid by slowly opening the clamp till required drops per minute are obtained. We have to regulate the fluid, like a micro drip set is there and macro drip set is there. Micro drip set is having 40 drops per minute, and macro drip set is having 20 drops per minute. And we can basically, by counting the drops per minute, we can regulate the fluid. So this is, I was explaining, this is primary IV bag. This is your spike of the IV set. This is drip chamber. This is the regulator, slider clamp or regulator. Sorry, slider clamp. This is the roller clamp or regulator. This is port. This is your connector. This is your lure lock or lure adapter. Lure adapter. This is your tubing, and this is the cannula. And here we have to connect the connector with the cannula. This is again the top parts of the IV set, drip set. This is a piercing spike. This is the drip chamber. This is the filter. This one is filter. This is tubing. This is roller clamp. This is lure adapter or connector. Now this is how the proper technique of intravenous catheter, how we have to insert a needle of, insert a needle of choice develop at a 30 to 40 degrees angle. We will insert the needle of choice and at the angle of 30 to 40 degrees. Advance the catheter to enter the vein until blood is seen in the flashback chamber. Blood will be seen in the flashback chamber. Steady backflow of blood indicates successful entry. After the catheter tip and bevel are in the vein, advance the catheter forward of the needle and into the vein. We have to advance the catheter forward of the needle and in and into the vein. Blood may ooze from the catheter, indicating successful entry. Dispose the needle, connect the plastic cap to the catheter. We will connect the plastic cap to the catheter, just flow rate as desired. And there can be catheter if it is inserted without vein entry. A power injector is attached. Vesicant drug is injected into the arm, causing pressure as it compromises the median and ulnar nerve. This is IV cannula. Now, drip sets. What are drip sets? These can be of two types, that is macro drip set and micro drip set. Macro drip set, 1 ml solution contains 50 to 20 drops and per ml, and micro drip set contains 60 drops per ml. Micro drip set is preferred in children as well as in the drugs who are having narrow safety margin, like anti-epileptic drugs, antibiotics, aminoglycosides, theophylline. They have narrow safety margin, so the rate of infusion and volume per minute is low as required for drops with narrow safety margin, and in children also we require the low dose, so we will use the micro drip set. Now, important points for IV infusion of the drug. Drug to be infused, make sure the drug is from standard or reputed pharmaceuticals. We have to make sure that it is from the standard or reputed pharmaceuticals. Drug is not expired or seal is intact. We have to make sure the drug is not expired and the seal of the drug is intact. Drug is in powdered form, then prepare drug solution with strict aseptic precaution before preparing infusion solution. Now, if the drug is in powdered form, we have to make the drug solution with aseptic precautions, and we have to check the amount of drug present per ml and total amount in 1 ampule or vial. This is what is the total amount of drug in ampule or vial that we have to check, and per ml, what is the amount of drug that you have to check. Now, before starting IV infusion of any drug, now what we have to know about the IV drug. Before starting IV infusion of any drug, adrenaline 1 in 10,000, 10 ml injection, which is used to treat allergy or anaphylactic shock, allergic reaction. Hydrocortisone succinate, which is intravenous injection, 100 milligram can be given. Antihistaminic like promethazine, hydrochloride, 25 milligram. They must be available for the allergic reaction. Then start suitable IV line and make sure it is patent. We have to make sure it is patent. Check IV drip sets and select the macro drip or micro drip as required. We have to select the macro drip or micro drip, whichever is required. And we have to check for the IV sets. Select a suitable solution to prepare infusion bottle. Example, normal saline, 5% dextrose or dextrose saline. Means if there is dehydration, we can give normal saline. If hypoglycemia is there, we can give 5% dextrose. And if hyponatremia is there, we can give dextrose saline or normal saline. So, whichever the condition is there, we have to select the suitable solution for infusion bottle. This is the same thing that is macro drip and micro drip. Per ml is micro is 15 to 20 and micro is 16 drops per ml. Now, this is the solutions of various strengths. Like 1% percentage, 1% means 1 in 100, 2% means 1 in 50, 5% means 1 in 20, 10% means 1 in 10, 0.1% means 1 in 1,000, 0.01% is 1 in 10,000, 0.001% is 1 in 1 lakh, 0.0001% is 1 in 10 lakh. 1 in 10 lakh, this is 10 raised to the power 6 is 1 microgram per ml. 1 in 1 lakh is 10 microgram per ml. 1 in 10,000 is 100 microgram per ml. 1 in 1,000 is 1 milligram per ml. Now, percentage solution and their strengths. Percentage solution, if it is 1%, means 1 ml of the solution contains 10 milligram of the drug. This 1% means 1 ml of the solution will contain 10 milligram of the drug. If it is 5%, 1 ml of the solution will contain 50 milligram of the drug. And 10%, 1 ml of the solution contains 10 milligram of the drug. Now, 100 ml of the solution contains 1%, it will contain 1 gram. and 5% it will contain 5 gram, 10% it will contain 10 gram. 1000 ml it will contain 10 gram, 5%, 50 gram, 10%, 100 gram of drug, 10%, 10 or 1000 ml of the solution. Now, calculation of volume or number of drops per minute in setting up of the drug. Now we have to calculate the how we have to calculate the number of drops per minute, how much we have to give. These can be, we have to calculate the rate of infusion, that is milligram per minute, strength of infusion, that is milligram per ml. Calculate number of drops with using macro dip will be rate of infusion divided by strength of infusion. Rate is how much is the uh, drug given per minute. Strength is how much is the drug given per ml per solution. Into 15 if the macro dip is there. So that will be the drops per minute. And when we have to multiply by 60, if the we have to multiply by 60 if micro dip is used, because micro dip has 60 drops per minute. Rate of infusion divided by strength of infusion into 15 is the drops per minute. So this is the calculation of the IV infusion drip of flow rate. What is this? It is the volume in milliliter divided by time. This is the calculation of IV infusion. Volume in milliliter divided by time multiplied by drop or drip factor, that will equal the IV flow rate in drops per minute. Like 500 milliliter of normal saline, that's 0.92% saline, is to be infused over 4 hours. With an IV infusion, dip set of drop or dip sector is 15 drops per minute per ml. So infusion rate will be drop factor multiplied by volume in milliliter divided by total time in minutes. So drop factor is 15, volume is 500 ml, and it's 4 hours. 4 hours means we have to calculate it in minutes. So 4, 16 to 4, 240, that will be in minutes. So drops will come out to be 30 drops per minute. So this is again another question which I cannot see because of the screen. Let me try. No, I cannot see it. I can see it now. A patient 55 years old male with body weight 70 kg having blood pressure 230 by 120 millimeter of mercury is to be started on IV infusion of sodium nitrosulfide, which is vasodilator, as 0.02 milligram per minute. It is available as the 5 milliliter as the drug solution 5 ml containing 10 milligram per minute per ml. Is to be infused in 500 normal saline. Infusion rate to be calculated is 20 drops per ml. So IV infusion will be drop factor into volume by time. Drop factor here is 20. Total volume will be 500 ml of normal saline. Total time will be 10 milligram. 10 milligram is the uh, in the per ml, and there are 5 ml. So 10 into 5 will be the total time will be strength divided by time. That is per minute, how much is to be given. That is 0.02 milligram per minute. So that will come out to be 2500 minutes. So infusion rate will be volume divided by time into drop factor. So volume is 500, time is 2500. So the infusion rate comes out to be 4 drops per minute. So that's all with IV infusion set, IV drip set simulation. I hope you understood my video. And if you like this video and if it is useful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be blessed. Stay safe. Happy learning. Thank you.